Hello, I'm Sang Park, prosthetic urologist specializing in penile implant, practice in Seoul, South Korea. I recently was invited with the Cleveland Clinic's men's health course. My topics were, the first one was about the local anesthesia with the IPP placement, and the second was the how to build the center of excellence, the penile implant. Now, local anesthesia is more popular in Western countries, especially in the US, because it has a better pain control after the surgery, and it also gives a surgeon, helps the surgeon's autonomy of when to do the surgery. I prefer doing my surgery on my own term. That's because, I don't want my patient to starve that long. I don't want my patient to go home too late. So I want this time frame to do the surgery. However, if I had to work with the anesthesiologist, my surgery schedule is affected by the other factors. Then my patient loses a chance to getting a surgery on the prime time. That's one of the reasons why I value local anesthesia, which is less discussed, because maybe that setting the timeline properly doesn't directly affect the surgical result, but however, like a baseline effect is must be there. So maybe patient is on a more stress or not optimal to get the surgery. If that's the case, post recovery may be delayed or even impaired in a case like that. That's why I was talking about local anesthesia, and it's always better to have more options within our surgical armamentarium. So I guess that is the reason why they wanted me to talk about it. And the second topic was about the center of excellence with the penile implants. First thing I want to talk about the center of excellence is that the title is not something somebody awards you. It is a concept of the practice that surgeon or the medical provider declare that you are going to run your practice according to this concept, which means that you want to reduce and narrow your practice or medical services you provide, drastically reduce it to the single item so that you can do this surgery or that procedure better to yield a better clinical result. This has been proved with the heart valve surgery and the total hip or total knee, like a joint replacement surgeries, and penile implant surgery. That's why I applied that concept to my practice and has been followed for the past a little over now 12, 13 years. So over the course, there has been many stupid mistakes I made, but I was able to modify it to the Korean, medical environment, and now I think this is important, and you have to set up your hardware according to that, adjust the software, and invent the software's processes or protocols to match that kind of care. Even though we give up other revenues generated by the other medical services, we are going to narrow it. And we are going to hyper-specialize it, something like that. For myself, after I applied to follow this center of excellence concept, what's funny is that I hyper-focus my practice with the penile implant. Now, actually, after a decade later, my practice is getting wider a little bit. I do the spinal anesthesia myself, and I also take care of the patients with the prostate issues as well, especially those who have an IPP surgery, already had a penile implant surgeries. So for those patients who already had a penile implant surgery, time to time, there are good chances that they also have a prostate issues, like a BPH. So for them, certain type of the BPH surgeries or procedures or medication works better. So that's why after the long period of my hyper-focused practice, now I'm branching off a little bit and a little bit. I guess that's something I learned over the course, and probably that is the reason why most of the successful practices in the US had it as a men's health center. So they kind of encircles all the issues with the men's health. This kind of concept is very important for medical providers and the patients on both sides. Hopefully this kind of things will help the surgeons to understand that some type of surgery needs a dedication to provide a better clinical result. After this talk, and I also thought that I always wanted to go visit the famous hospital in the US. my next target is Cleveland Clinic and the University Hospital of Florida. So hopefully I can be there and see and learn how they do.